I loved my childhood. So I thought that growing up in the Mehlville School District was fantastic. I was primarily involved in swimming. I was on the swim team, and I also was in the band.
Everybody knew that Kristy did well in school, but she was also talented. She played in like the youth symphony orchestra. She played in our band. She was full of school spirit.
After I graduated from high school, I wanted to go to college. I had planned to be a veterinarian. So Mizzou had a vet school. During my 4 years at Mizzou, I was all about going to veterinary school. In that time period before I actually started, I decided I wanted to go to medical school. Looked at schools around the country, and I opted to go to Johns Hopkins, which was like a continent away for this Missouri kid. Finished my medical training there, and then I decided to be an orthopedic surgeon. So I came back to the Midwest. I trained for 5 years in orthopedic surgery at Iowa. I did some specialized training at the Mayo Clinic to do tumor surgery, which is people who have bone and soft tissue cancers, both kids and adults, and that's what I do for my career.
You know, her patient care and commitment to patients, they almost become part of her family.
She definitely is aggressive in that regard to make it a more equal playing field for anyone, you know, and in her case, in the case of orthopedics, particularly women and minorities.
Kristy is super inspirational, both for me personally and for an entire generation of young orthopedic surgeons.
She's a person who would sit in a room with 10 powerful men around her and tell them what she thinks rather than what she thinks they want to hear.
My field of orthopedic surgery is the least diverse medical specialty out there. And so as a woman in the field, there's only 6 or 7% of orthopedic surgeons are women. And when I trained 25 years ago, it was even less. But I've also was recently elected as the president of the American Academy of Orthopedic Surgeons as the first woman. The organization has been around for 87 years. And so they never had a woman president.
A lot of people who bang down the door feel like other people should have to bang it too. It's like a rite of passage, and that is not her deal. Her deal is nobody else should have to go through this again, ever.
She's been kind of a beacon of promoting diversity and improving the culture of orthopedics on a, community, national, and even international level. And for that, I think we as female orthopedic surgeons are going to be eternally grateful.
About 35% of our residents in orthopedics are women now, which is a much higher percentage than we have previously, not because we tried to exclude women, but she has championed the role of gender equality.
You can achieve more than you think if you're just willing to work for it. And I think she exhibits that.
She's a critical thinker. She's creative. She's not afraid to face difficult conversations or challenges.
She really cares about everything she does. So a lot of who she became and what she does comes from a genuine place of caring about her friends, about her career, about her patients.
To get the letter was it was such a thrill. I'm honored to be thought of as someone who would actually be considered for that. It was just such a great time in my life to think back of, and still have friends from that time that I interact with and that I see and that I talk to, and that all feel the same way about Mehlville.